mentioned the hospital. You guys want to come up here? They got some stuff to say.
Well, we'll get started. Sure.
Is there a bell?
You bet.
That's all right.
You okay?
Okay, we need to.
Excellent. Well, I'm Cindy Sturgar, and I'm the interim CEO at the clinic. And we are totally a separate, independent business from the hospital, but of course we work really close together. And we just wanted to have an opportunity to visit with the community and answer any questions that people might have, because there's been a lot of people engaged and concerned about healthcare here. So that's who I am. Larry will introduce himself.
I'm Larry Putnam. I'm the interim CEO. We have two of them, I guess, one for the hospital and one for the clinic, and I'm the hospital guy on the critical access hospital side.
So we don't want to keep everyone too long. We know people are eating, and if people have a couple questions, we can do that. I think you all know there's been a lot of things that have gone on in the community in the past couple years with the hospital and with the clinic, and there was some change in personnel. And so our job here is to make sure that we provide excellent care for our people in our county. And so that's what we're trying to do. And the Community Health Center, or Mineral Regional Health Center, is a federally qualified community health center. And so what that is that we provide access to health care regardless of people's income. And so we don't set those incomes, those are set by the federal government. And I'm just going to, these are just information sheets, but you can see what the income is. Every year the federal government puts out their income, and then we provide a discount according to people's income. So you can pass that down. A lot of people in this town are covered by Medicare, so we're lucky, right? That's a lucky thing to have. But there are many people, there's about 50% of the people that live in your county that qualify for a discount. So they live
I should take
on
that.
this. And I grew up in a family of 11, right? So if you look over here, the family size of one, there was 11 in my family. There were 9 kids and 2 adults. And so we would have qualified for a very significant discount. We were totally fine. We all worked, we did stuff, but according to the federal government, we would have had an opportunity to qualify for a discount in health care. My dad was a teacher, so we had medical coverage. We didn't have dental coverage, so we had to work out deals with the dentists. You know, we all have to do something. So today, there's community health centers, and so we provide a discount for people who don't have coverage, right? So if you came and your bill was $90, and you had a family of 3 and you made $18,000 a year, you would qualify for almost 100% discount. We'd ask you for $10 to help us pay, you know, for the fee. So that's what community health centers do. And then we're working with dentists. We're having a big dental clinic for kids coming up March 6th. We'll be doing some more work with dental, and we work with mental health services. We try to make sure that all of the prevention for outpatient, remember we're the clinic, outpatient, we don't want you to go to the hospital. We want you to stay healthy. We're happy to have a hospital, but we really are trying to keep you healthy, right? That's what we do. But any questions about this, and you can take a look at it, let me know. What are you guys? I forgot to do this. How about, can people hear this question, or I can repeat it too? The clinic has had a turnover in doctors for the last 3 years. That's right. Right. So, the question is, how come doctors leave so much at the clinic, right? So that's a really good question, and I've worked in lots of towns, and they all have that same question.
So have I.
Doctors leave in every town.
So have I. This is the 5th interim assignment I've done in the last 6 years, and every community that I've been in has the same issue.
I know, I wouldn't have moved. I wouldn't have moved. You're lucky. It's really, really hard to keep the same doctor in a tiny town, for sure. So the doctors, lots of smaller towns, yeah. Go ahead.
How many doctors do we have and PAs at the clinic now?
At this moment, we have, so the clinic operates 8 hours a day. We have one doctor that's full-time. We have one PA that's full-time, and we have 2 other doctors that are gonna do some part-time work with us, but they haven't given me their final signature, so I can't tell you who they are yet.
So who
Are they
covers,
doctors or are they?
They're
PAs?
doctors.
Okay.
You know, the question about PAs, it's really frustrating. I was in a community for 14 years that ran with one doc, one PA, and one nurse practitioner. Okay. I just wish that communities would get over this stuff where only the doctors can provide care in a clinic. PAs and nurse practitioners are just as well qualified to provide, certain services. Yes, they are. They are.
It makes it seem like the doctor's kind of stupid if he has to do his work in 8 years, all they can do theirs in 3 or 4.
Okay, so here's the continuum of care. So it's really hard for us, right, to understand this because of how much they get trained. You gotta ask those questions. You're gonna find doctors who aren't very good that have 300 years of care.
Right.
And you're gonna have nurse practitioners and PAs who have a couple years of training but lots of years of experience that are gonna be just as good. And the reason they're good is when it gets too complicated, they hand you off to an MD. That's the difference. There is 80% of everything we do in healthcare can be seen by a PA and a nurse practitioner. Now, in this crowd, as we get older, we get more complicated, right, our diseases? You still can be seen by a PA and a nurse practitioner, but as you get complicated, many of us go see specialists, right? Once a year, then the specialist says, here's your treatment plan. Here's what I want you to do, Cindy, for the next year. Come and see me in a year. When I'm doing that, I can see a nurse practitioner, I can see a PA, I can do all of that. But if I'm very, very complicated, I'm probably not even seeing a doctor here. I'm going to Spokane, I'm going to Texas, I'm going to Missoula, right? PAs and nurse practitioners are the standard of care everywhere in the United States, and they're going to be more and more and more, because not very many people want to be doctors. It's not that fun. It's just not that fun. They can go be attorneys and make more money. They can go to Wall Street and make more money. They can work in IT and make more money. I mean, it's just a fact of life in the United States.
who's covering the emergency rooms?
We have 6 providers, the same people, the one doc and the one PA that Cindy employs also do ER coverage, not during the day, however. We've separated that off. We have to cover our own situation during the day. We have 4 other PAs that we call them the ER boys. We have three guys who cover planes. They work at several other places too. Between them, one of them works in a private practice in oncology practice, I think, in urology. Yeah, in Missoula. So, and KT, who provides services also from Folsom. So we cover that ER 24 hours a day, 365 days a year with PAs and Dr. Pafford and Laurel. So we have 6 people that provide that coverage.
KT was gone, huh? She went to Folsom?
Who did?
KT.
She's working at the hospital.
She's an emergency.
Right.
She's really an emergency room practitioner. She loves it. That's what she wants to do. That was her decision. We're happy to have her.
Right. Yep.
I'm not sure that this is true, but
Blonde, tall blonde.
Does it cost the same to go see a physician's assistant as it does to see a doctor? And
Yes.
why? If it, is that true?
Yes, it costs the same. So billing with Medicare, Medicaid, private, you are gonna bill the same amount. Again, if you're doing a stress test, you're coming in for a whole bunch of stuff that's with heart docs, right? That's a whole separate deal. But the way Medicare and Medicaid have it set up, you don't get a cheaper price if you go see a PA than you do if you see an MD for primary care, right? Primary care. When you get into specialty care, you're in a whole different arena. But in primary care, which is what we do in the clinic, you're gonna get billed the same regardless of who you see.
But why is that when, you know, somebody else before said, you know, you're seeing somebody with a lot less, education and, knowledge.
So again, in primary care, which is kind of our prevention, what are the wellness stuff? At some point in our, not maybe in my life, but in my kids' life, they're going to be able to take care of a lot of their own stuff, right? We're going to get so good in the United States with electronic feedback. Like if I'm a diabetic, they have it right now. Then I'm on a pump, the pump's going to beep, and it's going to take care of me. I'm going to do so much more in life with electronic feedback than we ever have. Same thing here, there's a lot of primary care stuff, but I want someone to look at me, right? So depending on what I'm coming in for, both the PA, nurse practitioner, and the MD, depending on their scope, are going to say, great, I can do that for you, or they're going to say, geez, I need you to see the MD because you got complications, or they might call that person in, right, and say, take a look at them with me, right? Everybody does that everywhere. If the care at a primary care clinic is beyond that, they're going to send you to a specialist. That's their main job, is to assess you and make sure what you're getting seen for here, we can cover. We can't do everything in Superior, Montana. We can't do everything in Missoula, Montana. Okay, but we can do prevention and general primary care here. Things that are outside of that, our guys are going to send you somewhere else or say, where do you want to go, right? So I know that's confusing, doesn't make sense. It's just how it works in the United States. How it works. Larry, do you want to
Well,
comment on that?
yeah, I don't need enough for everybody, but sure.
Some more information about the hospital.
Well, I'd just like to kind of go back for a minute. I'm a business type, but Cindy and I both are. I mean, that's our area. I've been hanging around critical access hospitals for 32 years, and that's little ones. That's my thing. And I just really need to plead with you that you need to be using this facility. You really need to be using this facility. And for the last 3 months, I've been here 3 months, a great community, wonderful community. We have a great board, we have a great staff at the hospital. One of the best leadership teams I've ever worked with in a small hospital. We have really good folks. But the community is not using us. Our volumes have been dropping off. And the last 3 months, I hear all these excuses, you know, well, why don't we have Dr. Smith, you know, come back? Well, Dr. Smith isn't here. Dr. Park is not here. You know, he's been off the staff for, what, 10, 12 years, or however many years he's not been off the staff. And if you don't start using this facility, it won't be here in another year. We are in serious financial doo-doo, you know, with this hospital. And we got to get beyond these excuses. You know, well, I don't come in there because, you know, it's more fun to go to Billings, that's my hometown. But it's more fun to go to Missoula and shop, you know, or something. The real reason is, you know, something other than the quality of the healthcare. I will assure you that we have really, really, really high quality medical providers up there. They are really good folks. They provide very high quality services. in spite of some of the rumors that I hear and, you know, running around in this community, and all small communities are like this. I've been in about 7 of them over the last 30 years, and they're all like this. The whole community knows something, you know, before it even happens, you know, the word gets out, you know, gets around, you know, but whatever your excuse is for not using the hospital, I would just plead with you to please give it a try again or start using this, because if you don't do that, there really is a chance. It's the closest I have ever seen. We only have about 10 or 12 days of cash in the hospital. And Cindy and I have worked our tails off the last couple of months to get this thing turned around, and it is starting to turn around. But we have to have the public support and the community support to use the facilities, or it won't be there. I'm really serious. I'm not crying wolf here. It will not be here. It is getting better. We really had some progress in the last month or so, and the cash is starting to turn around. But going forward and making this thing happen in a small community like this it's difficult because there aren't a lot of people in this county. There's only about 4,000 people in the county. Another excuse I hear is, well, Plains, you know, they got all this great stuff going on in Plains. Well, sure they do. They got 12,000 people in, you know, Sanders County. We have 4,000 people, and you know, everybody in the Alberton and that end of the county does go into Missoula because it is closer. But so really, our service area up here, you know, Cindy and I have talked about this quite a bit. There's about 2,500 people probably that really use this clinic and this hospital here. And the best thing you can do to help us, please come in and use our facilities. There is world-class imaging up there. I mean, the imaging with the mammography machine, the CT scan, all of the imaging that ultrasound, I have not seen that kind of imaging equipment for this size community. The ultrasound alone is it's really amazing. You know, the kind of capability we have with ultrasound. And we were talking about it today. I'll just give one more example. Well, I'll talk about the example and then talk about the surgery situation too. You know, there's a CT up there. It's been there, I think, 4 or 5 years. But it is so important. It is so important that we have a CT scan in Superior. My old hospital up in Malta, I was up there for 14 years, and we had this debate for 5 or 6 years with the medical staff. We really couldn't afford it to put a $500,000 CT scan in, but we did that. And the reason we did that was because the docs in the mid-levels, and I've had the same discussion with the mid-levels here, the PAs and nurse practitioners that cover the ER, but somebody has a stroke, and this population here we have a couple, 3 of them every year. Okay. Kirsten tells me, and if you don't have a CT scan, if you don't have an ER, and you don't have that CT scan there, strokes are of 2 types. You know, they're a bleed or a blockage. Okay. That's the way strokes occur. Been a lot of publicity about strokes, you know, in Montana over the last 5 or 6 years. You know, you need to get into the ER within 25 minutes. Get the Braino stuff, but they have this medication that they give you that opens up. If it's a blockage, it'll unblock the blockage. Okay, and they call it Braino. It's like Drano for the brain. It opens up your brain and helps with the stroke. Okay, but if they give that to somebody that has the type of stroke that's a bleed, it'll kill you. Okay, and the only way to tell the difference is with a CT. With the CT scanner. And so, if we don't have people coming into the ER, if we don't have people coming into the primary care clinic and using our facilities, we don't have the money to, you know, and that ER goes away and people come into the facility, they aren't going to make it. They aren't going to make it to Missoula if we lose the hospital. So, I'm just trying to tell you some of the facts, you know, and the way we see them, I guess, and just ask for your help and ask for your cooperation to use the facilities. I've had a lot of questions since I've been here in the last 3 months about how people can help us, and Cindy and I we've done these sessions with a lot of public groups over the last couple of months, and you know, we always have the same answer, you know, please use our facilities. One more thing and then I'll shut up. I tend to talk way too much. John knows that. He's experienced my ramblings before, but and John did a great job of recruiting a couple of physicians here, a couple of surgeons. Dr. McClellan that was kind of here anyway, and we cranked up this ENT program. If you have kids or grandkids that if they need ear tubes and tonsillectomies and stuff, be sure and have them call the clinic, because Dr. McClellan is a great guy. He's a wonderful surgeon, you know, a really high quality guy. And
Too bad there's nobody there when you're having a baby.
well, again, there aren't very many. I know of no hospitals in the Northwest United States actually of this size that deliver babies, mainly because of the malpractice stuff with OB physicians and the lack of anesthesia, you know, with a C-section. It's just too risky. It's too risky. But the other one that we're working on, and Dr. Gardner, who John was very instrumental in recruiting here, a general surgeon from Polson, is starting up a practice here with us to do scopes, you know, endoscopies and gastroscopies. And I'm of the age where I've had a couple of those, and you know, if you can get them here rather than having that prep and running into Missoula, you know, for a scope or something, that's really nice. So he'll be starting a week after next. He will be starting with scopes and with other minor surgeries, lumps, bumps, and hernias, kind of we call it. But
Is that doctor from St. Mary's going to be back over this way?
I don't know who that would be.
He did a couple of operations on my hand.
I couldn't.
Orthopedic surgeon, no,
Yeah.
he's gone to North Dakota.
Okay, someone in the past.
I need another one.
Well, Dr. Gardner is an excellent guy. He really is. Used to practicing in small communities, but the way you can help us is to really use our facilities. We really would ask that you try to do that as well possible.
Do you really understand, you've just been here a short period of time, you really got your pulse on why it's gone to the point where you're talking about? Do you really know why?
I gotta go.
Well, we know from hardcore facts why.
What are your hardcore facts?
Well, there was a lot of management in the past that didn't pay attention to some very,
We're deep.
very detailed, tiny things that grew to be big things. Yes, we're very aware of that.
We're paying for that.
That's what I'm just trying to tell you. I hope you can get it turned around, but I'm telling you right now, it's like anything else. We worked and worked trying to get the St. Regis West End involved, because there's population down there. They go to Plains. Yeah.
We see a few of them at the hospital clinic here.
But, so
Quite a
they
few.
opened up a clinic down there. Okay, got that all going. Now, due to the budget strain, you cut it off. Do you realize, and I've lived here since 1947, so I'm telling you now, I know a little bit. It's taken a long time for them to finally accept the hospital, started to use it due to no fault of your own, per se. It got shut down.
That
You
clinic
realize
should
how
have never
long-
been built in the first
Well,
place.
that's beside the
Should
point.
have never been built in the first
But I mean, they did something, it was donated, yada, 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 through grants, the whole bit, I know the whole story.
Yeah, we're
I
with
just
you.
didn't fall off the turnip truck. Then you shut her down.
Right.
You just got them people to start coming aboard, like you're trying to tell us now. And then, the other thing was, 3/4 of the people that go up here, well, you gotta go to Missoula for that, you gotta go to Missoula for that, you gotta go. Then you wonder why they go to Missoula? If I have to go to Missoula to have the procedure, I might as well go to Missoula to see the doctor. I'm going there anyhow. So that's what you're up against.
We understand.
But you got the VA like us.
Pardon?
Plus you have the VA like I am.
Yeah,
I don't even get to go to Missoula. I gotta go to Helen or Denver.
right. I mean, we
There's no
both
cancer doctor in
Right.
Missoula.
We've worked in really small areas, so why do we live here? Why is this beautiful? It is beautiful here, and there's hardly any people. So we will never have every service that we want. We will always have, we hope, we will keep primary care. We totally understand what went on in St. Regis. We will apologize forever. It was we just can't do it because of the cost. But we totally understand. We're right with you on the big decision that was, right? That wasn't an easily made decision. It was we talked with the people who donated stuff. We did a lot of talking with folks to let them know that it could kill us all the way down if we don't do something quick. So, we still have some hope for that, but it's going to take some months, right? It's going to take some months. It's like, all of us.
We were told that, you're going to try working with the VA.
So if you've ever worked with the VA, okay, we love the VA, but we all know that the VA we talk about limited resources, they have limited resources. There is, I think, the last time I was at the VA, there was 64 different programs in the VA that you can qualify for as a vet, depending on length of service, if you got hurt on the job, in the blah, 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 it goes on and on and on. Heaven only knows how we make it so difficult to give our vets service, right? But we do. We are not going to get anything here that is sponsored by the VA. I mean, we just need to. We're not going to. We're too close to Missoula and we're too close to Helen. Go out to Scobie. They're going to say they're a lot farther away from Helena than we are. Right? And that's our center. We're with you. This is a big VA community. Big, lots of vets here. You'd think, right? Okay, again, there's only 4,000 people here. We don't shake it. We don't shake a candle to these guys. I mean, we do the best that we can, but we're not going to get it. You can give emergency care and maybe get reimbursed. We didn't ever get reimbursed in some other communities. I mean, we tried, but after you spend, a whole staff person for a year trying to do it, you lose money, right? You just can't get it very fast.
If you're a Medicare age, you would be paid for it.
In theory, yes, you can. I know, that's what I'm saying. In theory, yes, but it takes a long time to get it reimbursed if you call the money to come back.
Did you have a question?
Yes, I did. With the money part is not our fault.
Right.
The money part is people that are gone away already. And we're all trying to stay with the doctors and PAs or whatever. But the money part was not our fault.
No, we understand.
It was not, absolutely not. We are so with you on that.
Thank you.
So with you.
Understood.
We think the public was probably taken for a ride a couple times.
Taken for granted, yeah.
Right. Good intentions. There was never any bad intentions by the previous people. I don't want to lead you down that road. I have worked when there were evil people who were before me. These was not the case here. But they were going down a line of strategy that we couldn't bear up. We couldn't financially bear up. They, in their minds, thought so, but there was absolutely no way to do that. They were not evil people.
Was there something wrong in the billing department with the software?
So at the clinic,
Right, at the clinic.
so at this clinic, anytime you put a new billing system in, it takes 1 year minimum for it to work well. Well, this somehow has taken about, it went in January of 2012, and from my understanding, and I came in October, it only got working in the summer of 2013. So it took a lot longer than 1 year, but that is the key reason, the new system.
Like Obamacare.
The electronic stuff is very, very taxing.
Why didn't the vendors and the software people come back in and try to correct it?
Surely we should have had you on it, because I'm telling you what, it's really, really, out of everybody you work with in healthcare today, IT people, especially our size, they're gonna go, oh, those people in Superior. I was just at the IT place today, in fact, and on the board, they have Superior, and they go, no, thank you. I mean, you have this attitude, we don't wanna leave the mothership, go out to the little people, right? So I turned around and told those guys, because I know some of them, I go, I want you to put, I'm signing up to go out there. You know, I'm joking around with them, but you need to know, we are little. So they think, you know,
But we need the funds to keep going.
I know, but even if we pay them a big price, which we do, in the big spectrum, they're taking care of us, but they don't jump to us, right? And there's like 3 different levels of a contract, and there always is. They have one with so-and-so, has one with so, it's like your phone bill. Have you ever tried to call the phone people for your internet at home, and they go, it's not the phone, it must be your internet company. Internet company goes, not my company, it must be the phone. Exact same thing.
So you're not getting much help from the
We are turning things around, but it takes a lot of effort. Everybody knows us. Everybody knows Larry, everybody knows me. Everyone in the IT world knows us.
When are you going to get a licensed boilerman up there in the hospital?
Probably next Friday, the two maintenance people. Yeah, let me address that too.
There's only 4 in this town, of which I'm one of.
Are you
So I know you don't have one.
Are you you?
Do I what?
What's your name?
I'm Ed Happy.
Oh, okay. I didn't know
No,
about
I'm
you,
not gonna
but
come to work for you.
I knew about you.
Be careful.
Yeah, right. He's bigger than I am, a lot bigger.
We already talked to you.
What's that?
We already talked to you, and you're not using his license. He flat told us.
Well, just listen. Just listen. You do not need anyone with a boiler license. You do not need anyone with a boiler license.
Then why do you have a boiler that needs a boiler license, man, in that facility?
I have been in 4 different hospitals in the last 5 years that had no one on staff for periods of time, without a boiler license. Buck, when he got here, did not have a boiler license for a year. We ran the place without a boiler license for a year. The boiler inspector did not care about whether we had a boiler license or not.
Really?
And that's a fact.
Your insurance company don't care.
No, it does not.
What insurance company do you have?
It is not.
What insurance company do you have?
I have no idea.
Well, you need to call them, because they are gonna cut your insurance in a minute.
No,
When you have a boiler in a hospital or a school, you can have one in a mom and dad laundromat and get away with it, but you can't do it in a facility where there's people.
No, it's not correct.
Yeah, whatever.
Not correct. Not at all.
Call your insurance company tomorrow and ask them.
It's Hartford, I think, which handles most of the boiler insurance around the country. I have a lot of experience with boilers, and boiler licenses in small hospitals, and it's not an issue with the boiler inspector. I've talked to the boiler inspectors personally.
Who is the boiler inspector?
The state boiler
So
inspector.
what's his name?
I have no idea.
See, so you haven't talked to him.
I have in
Just
other
keep covering it
facilities.
up, keep covering it up. That's why they're not using your hospital, because you're not going by the rules.
Oh, that's crazy. Absolutely crazy. The 2 guys that are on staff, we made
Neither one of
arrangements
them
for
know
them.
anything about a boiler. They don't.
Hey, you can come up and run the hospital, I guess, That'd be good. It is not required that we have somebody on staff like that for a boiler license. It's not required.
Is this just hospitals that don't need boiler licenses?
In the 5 hospitals that I have been in the last 6 years, there have been periods of time in each one of those facilities where I have not had a licensed boiler operator on staff.
The schools need, and I worked for the county for 40 years, and I know we get the boiler license. They would come by and inspect.
Well, Buck did not have a boiler license for a year. For a year. We didn't get shut down. They didn't come in and shut us down.
You don't need a boiler.
No. You have to have someone that is working toward it. That's correct, you do. And we have done that. We have a guy that Angelo Rivera's, put us in touch with, to get the proper training. And he will be here actually next Monday, and he will provide that training. And by the end of next week, we will have 2 boiler licensed people on this. We are fully aware of the issue, and we're handling it just fine, and I don't think the community should be all that concerned with that.
Are there any other questions that you have about, yes, ma'am?
Did you ever get a new EKG machine?
We have 3 new EKG machines.
Okay, good.
A couple at the hospital, and we have one that we haven't been using it at the clinic because we've been having people go to the hospital, but we can't do it at the hospital. We have some of the best EKG machines because I almost
Very
fell
nice.
over when I saw how much they cost. I bought them for much cheaper.
Because it took him 5 times to get
I laid
the
up about 5 hours to get EKG working on me.
Really?
Yeah.
Okay, so
This
EKG
will work.
machines, sometimes, depending on you and who's ever doing it, sometimes, yeah.
And
They're
back to the hospital thing. To me, see, like, I didn't worry about doctors when I was younger. I went 5 years without going to a doctor. I went once a year and had a physical, so it was required. But now I'm getting older, I need one. Was cost me 10 times more to see stuff now than it did. I got everything free when I was working. Now that I'm retired, all of a sudden the copay, this double, triple, and it's just taking what I've lived with all my life away. And then when I go up, I see like every time I go, I get a new pill. It's like they're pushing, selling pills more than taking care of me. And see, I don't mind the PA. I've liked most of them here, but now I want to trust the doctor I see. Before I went in just for general purpose. Now I got diabetes, got high blood. So now I want to trust the person I'm seeing. Well, I just get trust in somebody, and I've been here since 1999, and I've had about probably 12 PAs and doctors since I've been here. And so I insist on a doctor now, because maybe he'll stay a little longer. It's not nothing wrong with PA. It's a matter, I want somebody, when I go back in there, I want to see the person again and get to know him.
And I'm right with you. You are right on. We all want that. We're doing the best that we can, but it is the most difficult thing in America. There is no Dr. Parks left. We don't even breed them like that anymore. Don't ask me why, but we can't find them. So we keep doing the best that we can. I mean, I'm so with you. I'm so with you. We want, you find a good one, you want them to take them with you. You just wish you had them, right? We're right with you on that. And we're working as much as we can, but a lot of stuff is just out of our hands, right? People make their
I
decisions.
understand the situation, but it's just a matter of...
Yeah, we're right with you. We
That's
agree.
the only reason I go to Missoula, just to try to get a doctor that can see the same doctor all the time.
I totally agree with this gentleman. I've worked all my life when I was younger. But when I did have to go, it was 100% covered. Now that I'm retired, I'm spending so much on medical, it's unreal. I have Medicare, my supplemental insurance, co-pays, and then they don't cover everything. I still have to spend my effort.
I'm with you. I have the same
Thousands
thing.
and thousands of them. I never had to when I was working.
Totally with you.
And I think it's good.
Totally with
For
you.
seniors to have to spend.
Honey, it's public policy. I'm all for it. We want to change. I'm right with you.
But I have
Whatever we can do.
paperwork that you keep money clinic and Medicare to get everything straightened out.
Oh,
Plus, they had me not married after 53 years. I still was there. They gave him Wayne Rose and Hamilton paperwork instead of Wayne Rose.
really?
Carry her out in the hospital.
Totally.
Yeah, that is, it is something, isn't it? We do so much in the United States to make it difficult for us to get things done. We make it so difficult.
20 and they still want your pass. I'm not paying it. So
Yeah, exactly.
I got 80/20 and
Yeah, I know, it's very difficult, but,
and they paid me by the time I do all the calls and fax it, all kinds of, gee, Mrs. Rose, thanks a lot for straightening this out. Why didn't they do it? Vaccine, everything.
I'm totally with you. Absolutely. We shouldn't have to.
Isn't there some way that they can have a PA when he comes in and signs a 5-year contract or sign a contract?
You can, but people leave, right? They can sign away as much as they want, but there's always an out. I mean, it's just, you cannot make people do anything. They have to fall in love with the place, right?
Because I didn't even know the history of PA until I talked to my daughter. You know, a PA was in the Army, it was a guy that
That's where they came from.
wrapped the arms in, stuff like that. And
It's just, they call her, but she tells us like,
I know. Yes, they are. You are lucky to have her. Lucky.
I have a niece that's the same way. We call her, she's a nurse practitioner. We call her every once in a while to get some advice.
I'm looking. And when you find a good nurse, most healthcare in America will be nursing care. And good nurses, never let them go. Live next door to them, do whatever you can, because they are the best ones. Nurses are incredible. Yeah, that's right.
I'll tell you another one that's she worked at the hospital, and her husband was a teacher. And she's supposed to
First hospital
say there was another nurse that was
in Whitehall. In Bowles.
I miss Gail at the slave, I call her.
Whenever you have
When you're too tall for the
Little town here in It's just amazing. So Anaconda Park, they passed. He said, I mean, I know them all. They're all the guys that are going from the guy begin.
was you. The very first one in the 70s. They really say it everywhere. Just financially. When I was in Walmart, we built a new hospital. We replaced the 1850.